Hello everyone, and welcome to this episode of Lifestyle Matters. And once again, we have the good Dr. Savina with us. So Savina, I thought today we'd talk about the portfolio diet. What is the portfolio diet, first of all? What's in the portfolio diet?
Simply put, a portfolio diet is basically a diet where you consume very, very small amounts of saturated fat, and you have a diet very heavily predominant on vegetables, protein, plant sterols, lots of fiber in your diet. So the four things that we look for is basically having nuts and seeds, about 50 grams a day. Plant sterols, which you get from eating fruits and vegetables, they naturally occur in these things, about 2 grams a day. And viscous fibers for about 20 grams a day, and soy, where you get your proteins from for about 50 grams a day. And that's what the diet entails.
It's quite a high volume diet, isn't it? Because you've got to eat actually a lot of fiber, or a lot of food, because it contains a lot of fiber. It's a big volume diet. You can really tell the difference, can't you?
Yeah, definitely. And some people can actually struggle if they decide to do the portfolio diet, because the bulk of their stools can increase quite a bit. And they can struggle with that too, and also get quite bloated from it.
So that's there's a couple of key points that I'd like to make about the portfolio diet. It is a high fiber diet, and overall, in Western diets, we eat about 20 grams of fiber a day. But actually, for optimum health, we need to actually be eating 40 grams of fiber for a woman, and maybe even 45 grams for a man. So the portfolio diet actually really does bulk up the fiber intake. And secondly, it's also deliberately modifying the fat content of a diet. So as you said, it's minimizing the saturated fat content, and it's maximizing MUFAs, and it's also maximizing stanols and sterols. Yeah, and actually there's a lot of margarine, because it's quite difficult to get enough stanols in the portfolio diet without supplementation from margarine. So that's what the diet is. But what's the point? Why are we even talking about the portfolio diet? Why bother with it?
So I guess it comes down to a study that was performed years ago, where people were assigned to two different groups. One group was having lovastatin, a common cholesterol lowering medication, and the other group were on the portfolio diet. What this study found was basically the LDL reduction, which is the bad cholesterol. The reduction was almost the same. In the statin group, the ones who were taking the lovastatin, there was a reduction of about 30.9% reduction. And those on the portfolio diet had a reduction of about 28.6%. And it's pretty astounding, when you think about the side effects that you can potentially get from statins. But why do we actually what was the reason behind the fact that the portfolio diet could reduce cholesterol?
Well, before I answer that question, I think it's important to understand that when we use the word cholesterol, we actually need to clarify what we mean, because there's actually the cholesterol molecule, and then there's lipoproteins. And there's good cholesterol and there's bad cholesterol. And so we know that HDL, high density lipoprotein, is a form of good cholesterol, because what that does is think of it like a scourer. It floats around the bloodstream and it cleans away all the muck that's stuck to the edge of blood vessels. So it polishes clean the blood vessels, the internal walls of the blood vessels. And so that means that blood can flow smoothly, right? So HDL is a good molecule to have in your bloodstream. The opposite of high-density lipoprotein is low-density lipoprotein. And LDL is basically a molecule that wants to deposit cholesterol and lipids everywhere, and that's a bad cholesterol. So we know that cardiovascular risk actually is not only is it directly proportional to increased total cholesterol, but it's specifically related to LDL. So, for instance, we know that coronary artery atherosclerosis and the progression of coronary artery atherosclerosis does not occur if the LDL is less than 1.8 millimoles. So if you can minimize LDL to that point, you don't get progression of coronary artery atherosclerosis. And we've spoken in other episodes of how the vegan diet can actually achieve, the average vegan diet can actually achieve an LDL of about 1.8. But so understanding why, or understanding the difference between good and bad cholesterol, then we go on to the fact that the portfolio diet reduces bad cholesterol. And in the study that you quoted, yes, there was a 2% difference, but that's clinically insignificant and statistically insignificant. So there's basically evidence that suggests that the diet actually is as good as medication at reducing the bad cholesterol. And so to answer your question then, why? Now, there are various theories, but basically the sterols or the stanols block the absorption of of cholesterol from the gut. And secondly, fiber blocks absorption of cholesterol from the gut, but it also lowers the peak of sugar absorption. Therefore, it reduces the insulin response. And part of the downstream effect of the insulin response is actually the production of triglycerides, fatty acids, and ultimately LDL. So there are two reasons why. So there's the direct effect of the inhibition of absorption of cholesterol, and there's a kind of an indirect benefit from the presence of large amounts of fiber in the diet. That's my understanding of how the portfolio diet affects the benefit. But what would you say to that?
Yeah. And I think they've demonstrated really good evidence to say that plant sterols are quite beneficial, that even the Heart Foundation has actually recommended it in their guidelines, saying, 2 to 3 grams of plant sterols and stanols are actually recommended in our diet. And as you pointed out earlier, it is hard to actually obtain it from eating just fruits and vegetables because they are just naturally occurring substances that actually just occur in low levels in our fruits and vegetables. So to get them, margarine spreads, as what you've discussed. That's basically, I guess, what I would also say about the portfolio diet. The only thing I guess I'd add to having, if you do have a very high amount of plant sterols, there is also some evidence to say that it can actually block your beta carotene absorption, and that is actually important to make vitamin A in our body, so for our eyesight and things. So what the recommendation is, if you do actually choose to consume a high level of plant sterols, the recommendation is also to have high beta carotene foods. And what this means is basically just having lots of fruits and vegetables that are colored, so carrots, pumpkin, broccoli, that likes of that.
Which again contributes to the fiber in your diet. Now, I think it's important to understand also that lifestyle medicine doesn't happen in isolation. And we're presenting the portfolio diet as one intervention that was specifically proven to have benefit in lowering LDL cholesterol, right? But we know that it has to be advocated within the context of a whole life change. And so there are other interventions that we can also use to improve the profile of our cholesterol. And by that, I mean increase the amount of high density lipoprotein and reduce the amount of low density lipoprotein. So we know, for instance, that resistance training and exercise actually increases HDL as well. So, it's not just about diet. And for those who are advocates of exercise, it's not just about exercise.
Yeah, and foods that are high in HDL would be things like, nuts and avocados and oily fish, basically. So trying to increase consumption of those things. But,
absolutely. Yeah. And also palmitic acid is a saturated fat, but actually some of the benefits from palmitic acid actually are that it increases HDL as well as LDL. So, it's very difficult to tease out one single cause and one single effect in all of these studies.
Yeah, and I guess it comes down to, there was also which I found quite interesting, was this study, people who actually followed the portfolio diet quite strictly, they also had another effect where their blood pressure was also reduced at about 6 months, compared to, for example, the DASH diet, which we'll talk about next, I guess. But, the fact that and it comes down to what you said just now, there are other effects, not just cholesterol lowering effects with the portfolio diet.
It has a wide range of benefits, which then comes back to the basic point that plants are good for you. A plant-based diet with minimal meat, minimal saturated fat is good for you. And, people say to me, oh, what vitamins should I take? Or or, what can I do extra? And I say to them, every colored vegetable that you eat is a pill. It is a cholesterol pill. It is a weight loss pill. It's really important to understand that plants, colored plants, a variety of plants, provide so much more than simply one pill, whatever pill and whatever condition we're trying to treat.
And not to mention, it's also for those who are, planet-friendly people. It's environmental friendly, and it's also sustainable living.
Absolutely.
You can grow crops anywhere, almost anywhere.
Almost anywhere.
So,
all right.
Yeah.
Well, I think we'll leave it there for the portfolio diet. Savina, thanks very much for your pearls of wisdom, and I look forward to talking with you very shortly. Thank you.
Thanks, Ferghal.
That's all for today's Lifestyle Matters. Thanks for watching, and we'll see you next time.